News at 9 continues.
As we continue to focus on the coronavirus pandemic here on Eyewitness News at 9, we're also focusing on your concerns and questions about the virus. Dr. David Schultz with Evansville Primary Care is one of our leading go-to experts. He joins me live tonight to answer many of your questions. And Dr. Schultz, thank you so much for being with us again tonight. First off, we reported earlier tonight in this newscast that at least 54 cases of the coronavirus have now been reported at the Tyson Foods plant in Henderson County. They process chicken products there. Should we be concerned about buying products made at that facility?
Well, definitely right now there's got to be concern when you have several employees at a facility who are now infected. But remember, a lot of the processing that goes on there is done with cooking, is done with processing and so forth, and they try to maintain a sterile environment and so forth. So it should be relatively safe overall. But right now that's a really hard thing for that company to decide what to do in lieu of all the public knowledge of that.
Absolutely. A viewer asked, why is the family not allowed to visit their loved one in a hospital when they are about to pass away from the virus?
Well, there are still concerns about passing that virus on to other individuals and so forth. And even though there's a lot of heartfelt concern and compassion for those individuals who have a loved one in the hospital who's passing, we can't simply afford to pass that infection on to the rest of the individuals in the tri-state. So that's why, again, it's very important for those individuals to stay at home and to try to remain immune to the virus, not being exposed to it.
Yeah, that's a very tough situation. A viewer who lives in a mobile home wants to know, do they need to wear a face mask when they're inside of their home?
Well, that should not be necessary and so forth. The air in a mobile home is very, very contained. The circulation there is not as much. But basically, the individuals that you're around in that mobile home will be the primary individuals you're exposed to. That said, people in a mobile home, for example, should limit how much exposure they get on the outside of that mobile home so they do not bring that virus to their dwelling.
Another question, Rick wants to know if constant headaches could be a possible symptoms for the coronavirus.
With coronavirus, certainly headaches are part of the diagnosis, and about 50 to 60% of individuals with coronaviral infections have headaches. But headaches are also more likely associated with other medical problems. And Brandon, we're seeing other medical problems become very important right now with people becoming very sedentary, our diets not being what they once were, with good mixtures of fruits and vegetables and low sodium. And as a consequence of this, you can also get headaches with hypertension or high blood pressure, and also with kidney disease. So definitely, if the headaches persist, I would seek out a physician's help to try to ascertain whether the headaches are from a viral infection or maybe there's something else like high blood pressure or kidney disease going on.
Right, okay. A viewer just called in asking if a person is a survivor of COVID-19, how long do we know until that person is no longer contagious?
Well, there's really two schools of thumb involved with this. And the one school of thumb is to try to get a repeat test to see if the COVID-19 is cleared from that person's system. That's the one school of thumb, and that's a very reasonable thing to do. The problem is accessibility to those tests. The other way is waiting at least 7 days of symptom-free period after having the COVID virus, and that's currently what's accepted.
All right, Dr. Schultz, we're going to take a quick break, and then we're going to come back with more of your questions for Dr. David Schultz. Stay with us.